My name is Dennis Dolny. I'm the department head of the Hyper Department at Utah State University. Our researchers in our department have partnered with the Athletic Sports Medicine Division of Utah State University. So we now have the opportunity to incorporate the HydroWorx pools that exist in our Sports Medicine Center with the research interest that our faculty have. And we have now 3 or 4 individual faculty members who are willing and able to contribute to the research efforts with the aquatic rehabilitation. Well, we learned very early on with our experience with the HydroWorx pools that we have a very unique opportunity to provide an exercise environment where individuals have a greatly reduced strain or stress on the lower extremity while individuals walk, jog, or run. And we can create an environment where we can challenge these individuals to allow them to exceed what normally would be an orthopedically limited condition on land, so they can achieve much greater efforts or sustain greater efforts while they exercise in the HydroWorx.
When someone who has arthritis, there's really no cure for it. So one of the sort of conservative ways for treating it is through therapeutic exercise. And it's something that if you stop doing it, the benefits of it go away. So it's something that these people are going to have to do their whole life to manage the symptoms like pain, stiffness in the joints. And so to find a therapeutic exercise that can be done in a short period of time and isn't monotonous is important for that group. High intensity interval training can be done in a substantially shorter period of time, less than 30 minutes, as we did in our study, in comparison to a more traditional form of exercise where they might be walking at a moderate intensity for a longer period of time. When people have osteoarthritis, they tend to have poor balance in comparison to age-matched controls. One of the research is showing that a therapeutic exercise that incorporates a power component seems to be more beneficial, for example, in improving balance, because you can imagine if someone is to trip, it's not how strong they are, it's how quickly they can achieve that strength that's more critical to recover their balance from a slip or something like that. So this high intensity intervals trains them to work at a much higher rate of power development. And so that's another biomechanical benefit. And then there's physiological benefits that are very comparable to what you would get with a traditional exercise program, like, for example, increasing HDL count, lowering your percent body fat, and some of these other physiological benefits. Yeah, so it was set up. It was what we call a double pre-test, post-test design. So then they engage in the 6-week intervention program, which again included the high-intensity interval training, or we call HIIT, and it also included a balance training component, which is also critical for these folks. And what we mean by the balance component is these folks are standing in the pool, and they're asked to stand, for example, as still as possible, and we perturb them with the jets. Then they engage in the aquatic treadmill activity, where they do a series of intervals, supermaximal intervals, they recover, supermaximal intervals, and then recover. And so that's kind of in a session we have the warm-up, the balance training component, then the intervals, and then a cool down. And that's all done within 20-30 minutes. And they did this 2 days a week for the first 3 weeks, and then 3 days a week for the last 3 weeks of the 6-week intervention. After the 6 weeks, then we post-test them, all those same measures we made during the pre-test, first pre-test, the second pre-test, and then now we have this post-test. They had to have been diagnosed with osteoarthritis through a local rheumatologist. And they also had to satisfy an algorithm that we use to what we call verify osteoarthritis, and essentially do you have stiffness and pain, and most people fit into that. So so we had this medical diagnosis, and then we had an algorithm that verified the diagnosis. And they also had to have some satisfy some inclusion criteria, in that they had to be able to walk, for example, without an assistive device. They had to be, for example, not taking a medication to control inflammation. Yeah, so the findings of our study tell us a little bit about how this intervention changed balance, functional tasks, and mobility. And of course, the big one is pain. And so it was really a collection of different measures that can help in prescribing this exercise, make a very clear sort of decision as to whether it's going to influence just pain or just mobility. We because it was in a way an exploratory study, this not having been done, this high intensity interval training, we tried to get as many outcome measures as possible. And so it's a fairly impressive outcome measure, in the sense that we showed improvement in every single one of those domains: pain reduction, improvement in balance, improvement in function, and mobility.
Yeah. You know, there's no doubt when you look at individuals who have osteoarthritis, we probably want to consider they only have a finite number of steps that they can take on land, whether it's walking and jogging or running, before the added joint stress of exercise on land under full weight-bearing support really causes a definitive change in the structural integrity of their joints. By moving to the water environment, we probably can achieve much greater benefits with much lower joint stress on these patients, and by using unique high-intensity interval-type training procedures, we can achieve that metabolic stress with much shorter time duration of workouts and arguably much lower steps taken during any particular workout, especially compared to the traditional workouts where people continuously train for 30 to 40 minutes at a time. And within 30 minutes, people can easily reach and exceed the energy expenditures and the metabolic stress with a high-intensity training. And for somebody whose knees and or hips ache when they have to move like that, that can only be a very positive feeling for them.
I guess one of the more shocking outcomes was this compliance or adherence, in that, again, they were engaged in this for 6 weeks. They had to come 2 to 3 days a week, and we had no one miss a session. Now, for many of the studies that I've done in the past with other populations, that's pretty impossible to get. And I think that says a lot about the compliance and their satisfaction with it. You know, of course, we kept a tally of some subjective comments, and we'd like to put those in the discussion section of the manuscript. They're not objective information, but we include those in there, and many of them echo the things that you will hear about in other studies, in that the aquatic environment reduced their fear of falling, for example, and it gave them a lot more confidence. That load elicited pain that they experience on land, they don't have that in the pool. So I think the biggest thing was that separates this study from probably just about any other aquatic therapy, was that these people are doing an intensity that they probably hadn't done since they may have been 20 years old or 30 years old. To get to a high intensity like that, again, releases hormones that make you feel good. And so there was a bit of euphoria in these people when they leave, and their motivation to come back was really high. You know, in order to, so balance being this capacity to maintain stability, if we can perturb someone, which means make them destabilized, then we can challenge their balance and improve their motor control capabilities, their vestibular system, and their visual system to try to improve balance. And so jets provide a great destabilization force. And it does so in obviously an aquatic environment, which again, if they did fall, they're not going to get hurt. And so it makes for a great scenario to improve balance, these jets. Again, destabilizing them challenges their balance because it puts them off their center of gravity, if you will, more precisely, goes outside their limits of stability. And so anytime we can push them to that limits of stability, we're challenging balance to a greater extent. Yeah, if they have a HydroWorx pool, they can progressively apply greater jet resistance to someone using what we call a double leg stance, just in other words, standing feet shoulder width apart, stand as still as possible. They could do that same thing with the jets being applied, double leg stance with their eyes closed to take the visual out so that it then focuses on just the other two sensory systems, proprioceptive and vestibular. And then they can do it even without the jets in that they can work on their limits of stability. In other words, try to challenge their self by going as far forward as they can or far back as they can or side to side to the point where they're going to have to make a step. And that challenges their balance. Again, they can do it in the water, and that, of course, is a much safer environment to do that.